The purpose of this lesson is to provide information on tobacco use, to give facts on what the drug does to one's body, help prevent use, and give information on how to get help or quit tobacco use. The lesson objectives for this presentation is to know the risks of tobacco and e-cigarette use, know how tobacco use affects the developing mind, know how to prevent it, and how to quit and how to get help.
Some fast facts about tobacco use. Smoking leads to disease and disability and harms nearly every organ of the body. Cigarette smoking remains the leading cause of preventable disease, disability, and death in the United States. And on average, smokers die 10 years earlier than non-smokers.
The risks of tobacco use include brain damage, high blood pressure, breathing problems, changed heart rate, lung cancer, and many other cancers, chronic bronchitis, heart disease, pneumonia, and diabetes, specifically type 2.
How tobacco affects the developing mind. The nicotine in any tobacco product readily absorbs into the blood when a person uses it. Upon entering the blood, nicotine immediately stimulates the adrenal glands to release the hormone epinephrine, or adrenaline. Epinephrine stimulates the central nervous system and increases blood pressure, breathing, and heart rate. As with drugs such as cocaine and heroin, nicotine activates the brain's reward circuits and increases levels of the chemical messenger dopamine, which reinforces rewarding behaviors.
Some ways to prevent tobacco use are to develop stricter laws, regulations of who can buy the tobacco products, and where tobacco products can be used, increased taxation upon those products, and restrictions on advertising, which would contain mandatory health warnings displayed on all tobacco products packages.
How to quit or get help with tobacco use. Behavioral treatments. Hang out with people who don't smoke or do things that can distract your mind. Medications. Bupropion, which is an FDA-approved non-nicotine medication. They target nicotine receptors in the brain to ease withdrawal symptoms. And therapy. Nicotine replacement therapies, chewing gum, transdermal patches, nasal sprays, and inhalers.
How to quit or get help. Behavioral treatments. Hang out with people who don't smoke or do things to distract your mind. Medications. Bupropion, which is an FDA-approved non-nicotine medication. This medication targets the nicotine receptors in the brain to ease withdrawal symptoms. And different types of therapy include nicotine replacement therapies, like chewing gum, the transdermal patch, nasal sprays, and inhalers.
Assessment. Question number 1. True or false? Smoking leads to disease and disability and harms nearly every organ of the body. Number 2. List 3 risks of tobacco use.
Assessment question 3. What FDA-approved medication is used to ease nicotine withdrawal symptoms? Assessment question number 4. True or false? Nicotine won't affect your brain activity or memory. And assessment question number 5. What is the leading cause of preventable disease in the United States?